Your child suffers from chronic ear infections. You know the drill all too well. It's the endless nights, the pain and tears, back-to-back rounds of antibiotics, and the looming threat of surgery. You tried all the Band-Aid solutions that never address the root cause. Now, once you experience this just a time or two as a parent, you start beginning to worry like mad. Every time your child gets a slight bit of congestion or the common cold, you worry it's going to spill right over and build up to a chronic ear infection again and again and again. Now, for many parents, that is exactly the case. Round after round of ear infections, followed by round after round of pediatrician and ER visits. And of course, round after round of antibiotics and all the side effects that come with it. Now, by age 3, it's estimated that 80 to 90% of kids will experience at least one ear infection, which should then get us asking the real question, what's different about the 1 out of 10 kids who does not get ear infections? Like to stop the cycle of chronic ear infections, to prevent them altogether in the first place, you got to watch this video all the way through. What if we told you there's a way to break free from the cycle of suffering without relying on drugs or invasive procedures? And this video will reveal the hidden cause behind most chronic ear infections and share a natural drug-free approach that's helping children find lasting results. This video is for parents of children struggling with chronic ear infections or seeking answers beyond antibiotics and surgery. If you're tired of temporary fixes and want to address the underlying cause of your child's recurring infections, this information is for you. We'll explore the surprising link between poor drainage, subluxation, and chronic ear infections. Learn how birth interventions and early life stresses can set the stage for these issues and discover how neurologically focused chiropractic care can help restore your child's natural drainage and immune function. Before chiropractic care, we had a child in the office, Luca, who would get an ear infection every time he got sick. At one point, he had 5 ear infections in 4 months. Luca's mom felt so bad that he would wake up in the middle of the night screaming in pain. And even after going on antibiotics, it would clear up the infection just to come back again with the next cold or virus that came along. He was on antibiotics back to back for months, and she knew that wasn't good for him long term, but didn't know any other options. The pediatrician suggested going to an ENT for tubes in his ears or some other sort of surgery, but mom didn't want to go that route if she could avoid it. After hearing about pediatric chiropractic, she reached out to see if chiropractic care could help with recurring ear infections. From her first call with our CAs, she felt like her concerns were heard and that we'd see many kids, just like Luca, in their office. Mom felt hopeful that we'd be able to help. Mom saw Luca's scan. She was really shocked to see how much of him was in the red. When the meaning behind the scans was explained to her, it made total sense why his body wasn't able to fight off these infections easily. And since they started chiropractic care, Luca has not had a single ear infection. Of course, he still gets sick like most kids do, especially preschoolers, but the colds never turn to ear infections. And he also seems to be able to get over the illnesses quicker. Mom believes that his overall immune system is stronger and he has experienced less frequent illnesses since he's been having consistent chiropractic care. And when they do catch something, a couple extra boosts adjustments get them over the hump and back to good health quickly. Now, there are many ways to help kids get through ear infections without antibiotics, surgeries, and all the side effects that come with them. Natural solutions and options not only help get through the challenges, but make the body stronger as a result of it. Now, chronic ear infections occur when there is a recurring buildup of fluids, inflammation, and swelling that block the eustachian tubes, leading to pressure and pain in the middle ear. And this condition is also known as chronic otitis media. Now, there are 3 primary causes of chronic ear infections that are all tied to something called subluxation. First, there is a poor plumber and drainage that result from misalignment causing extra tension, inflammation, and limited movement of the nerve and muscles that supply the inner ear, leading to a buildup of fluid. Second, subluxation also causes the body to get into an excessive sympathetic fight or flight state, leaving it in a high inflammatory state, producing extra mucus as a result, so double trouble. And lastly, the world we live in today has a ton of toxins, sugar, dairy, and so forth that stir the pot, making things much worse. Since antibiotics and fevers reducers do not take the root cause head on, and in fact make the gut immune system weaker over time, they are a major reason for recurrent chronic ear infections continuing to come back again and again and again. In the same way, many families are going gluten-free, added tons of supplements, essential oils, and so forth, still struggle, showing that these things may be helping some, but do not address the root cause of subluxation entirely. Now, our adjustments are designed to provide two main things to help kids and patients get to the other side of ear infections without drugs and surgery. They increase drainage and plumbing by getting things moving and clear once again, often very immediately. They balance out the nervous system and help reduce the sympathetic fight or flight state, reducing inflammation, just overall takes stress and tension away. In our office, the path to natural solutions and overcoming chronic ear infections begins with what we call our neurological insight scans. These scans directly measure the stress, tension, inflammation, and subluxation that so often builds up in the upper neck of infants and children struggling with chronic ear infections, stemming all the way back from birth interventions like forceps, vacuum, and C-sections that can create physical tension, twisting and pulling to the upper neck and middle ear areas, leading to all this trouble in the first place. To learn more about how chiropractic care can help your child overcome these challenges and get your child scheduled for their neurological insight scans, click the link below and learn more today.